This is a big concern for many people who are healing their mind, body, or psychophysiologic disorders. They're wondering if I should even stretch, or go to physical therapy, or do other manual mechanical approaches. I don't want to give my brain the erroneous perception that I have a problem with my body, so maybe I should stop all of that. So there are some questions in this area, and I asked Charlie Merrill, who is a mind-body informed physical therapist out of Boulder, Colorado. He has a lot of experience with peak performance and just anyone who's dealing with chronic pain or problems. So I wanted to ask him this question. And Charlie, the question is, how can I engage in manual therapies, such as stretching, without erroneously showing my brain that this pain is structurally caused?
Since I went a bit off script and didn't really answer the how question in my first video, I wanted to follow it up to add some important clarity. Now that you know manual therapy isn't doing what you thought, here's an important foundational idea as a starting point for how to seek out and receive body work and movement with a new mindset and intention. As an important protector, pain is a normal and universal human experience. While it's not designed to stick around for long periods, it often does because of the natural fear it creates. But when you start to view pain as a helpful message, you have an opportunity to get curious about how it might be trying to protect you. And if it's not due to a physical problem, which it's usually not, then what's the danger? The wisdom the body offers is an important and often missing part of navigating any pain experience. Physical symptoms offer insight into our subconscious thoughts, feelings, and behaviors, if we're willing to listen. So I consider physical sensations a barometer for what might be going on in our lives. But since most of us were not taught to speak or understand the language of pain, a gentle curiosity is required to see through the fear. So let's talk about how to use body work and movement to learn more about our psychology and our social realities. First, let's consider how we find the right clinician or coach. Number one, finding a clinician with expert manual therapy and movement skills is nice, but it's not a prerequisite. Many expert manual therapists, body workers, and movement teachers lack the other skills they need to make meaning from pain because they tend to be focused on the wrong variables, like fixing bodies. Instead, find someone with good training and a variety of skills that allows for some treatment flexibility. But more importantly, consider a clinician with strong therapeutic alliance skills like listening, connecting, presence, empathy, and compassion. You want to be confident in a clinician's technical competence, but these other relational factors are far more important predictors of your outcome. Second, any clinician invested in supporting you in unlearning and curing symptoms knows that fear isn't helpful. Hope, optimism, stoke, positivity, and encouragement are critical ingredients in your care. Remember, most pain is curable, and the process often leads to significant benefit, including growth in one's life beyond pain. So you and your clinicians are best served by frequently reinforcing hopeful narratives. If you start hearing language and messages that reinforce danger, like your body's damaged, your movement is wrong, your tissues are messed up, you should avoid certain activities, the pain's in your head, or you'll have to learn to manage your symptoms, find another clinician. Third, the best clinicians look to empower you rather than make you dependent on them. My experience is that you have all the answers and you have all the ability to overcome your symptoms. Our role as clinicians is to be a guide to help you access your inner wisdom as you decide what version 2.0 of you looks like. This doesn't mean you do it all alone or have to graduate from working with a good clinician. But remember, body work is supposed to be helpful in the short term so you can make the connections and do the other work that's important to understanding what is it your brain's trying to protect you from. What is it trying to teach you? If any clinician is doing the same thing over and over again with temporary or little change, especially if it's driven by a fear-based narrative, I'd encourage you to find someone else. Now that you've found someone you trust, how might you best receive manual therapy and movement? Well, first, you have to remember that body work does not fix your body. You want to start with a mindset centered around movement and touch as a way to converse with your brain and nervous system. Actively and explicitly reassure yourself that your body is safe as you receive touch and move in new ways. The goal of body-based treatments is to feed your brain novel and safety-inducing information about your body and the world around you. This is what your brain is craving, even if it doesn't always feel that way. Just like your brain needs information from your eyes to see clearly and information from your ears to hear clearly, think of your body as a giant sensory organ whose job it is to receive touch and movement, to reduce metaphorical blurriness, and really clarify the world around you. Second, collaborate with your clinician to decide which intervention is best for you. Remember, your nervous system knows what it wants and needs better than any clinician. Learning to trust that intuition is important. This doesn't mean the body work or movement you choose isn't something uncomfortable, intimidating, and even painful sometimes. We know that treating or moving into pain is also an active ingredient in reducing the sensitivity of the brain and nervous system to the environment, including to touch. You won't get pain-free by avoiding pain, and you and your clinician should consistently sprinkle active reassurance into the process despite some discomfort and fear throughout your treatment. Third, while you don't always need body work to unlearn pain, I'd argue that you need to move. If I use fear in my practice, it's paradoxically to reinforce the idea that not moving is actually more dangerous than moving, even though moving often hurts at first. As I said before, moving despite some pain is part of the unlearning process. Note that I'm not saying that you need to exercise. Exercise is goal-oriented, structured, and intimidating to many because of how it ties to shoulds, pressure, urgency, and often to past hurts. Movement, on the other hand, is requisite to life. It's not beholden to rules or burdened by expectations or goals. It's something I encourage people to self-define and discover based on our inherent need for wonder, awe, joy, play, fun, connection with others, and nature. Fourth, visualize what you want rather than what you don't want from your body work and movement. Whether you're lying face down, receiving massage or needles, face up, receiving energy work, or you're squatting, starting to dance again, or simply working towards sitting for longer periods of time, remember that the brain is always anticipating and predicting what's going to happen before you even start. If it's in a habit of predicting danger, and thus pain, you'll benefit from visualizing to interrupt that unconscious anticipation. Closing your eyes and seeing yourself in a favorite or safe or calm place in which you can imagine doing some new activity creates a new neural pathway to start replacing the old one. Or you can remember a time or place when you did some activity pain-free with ease. These are powerful ways to interrupt any automatic response that's become a learned habit. Similarly, visualizing how you want your brain and body to evolve as you receive body work actually changes your nervous system and thus your body's tissues. Get creative by trying to breathe softness into your muscles. Imagine your tension melting like snow in the sun. Imagine your muscles coming back online and getting power. See yourself floating thoughtlessly on the warm blue ocean. Or simply attend to and track the feeling of the touch you're receiving, noticing its nature. And of course, actively reassuring yourself as you go is, as you're learning, an essential ingredient. Fifth, use the sensations that arise during movement and body work as an opportunity rather than a threat. All of our physical sensations are connected to emotion, and all of our emotions are connected to a physical sensation. So lean into those sensations and get curious to understand what's coming up for you. Maybe the sensation leads to a sticky myth about your body that needs busting. Maybe the sensation connects to a past thought or feeling or behavior that adds clarity to a pattern you hadn't noticed before. Maybe if you tune in, there's an emotion arising that connects to something stressful going on in your life. One that you might have never connected to pain, like a relationship, a job, a past traumatic experience, some big life change, grief, or feelings of overwhelm. You can see how your relationship with any clinician is paramount here because you can then collaborate to understand how the physical sensations are connected to this deeper meaning in your life. Allowing the physical sensations that arise through body work and movement as a thread to our thoughts, behaviors, and emotions can help us make important connections to our subconscious mind that we otherwise wouldn't have access to. In this way, bodywork and movement are often missing ingredients when people engage in what I call a more brainocentric healing journey that tries to reduce fear by excluding the body. Now, I acknowledge the challenge this creates for providers and people in pain. We don't want to send the wrong message that there's something wrong with the body, but we also don't want to miss the opportunity to leverage an important bottom-up somatic strategy that can change the nervous system. Luckily, there are a growing number of clinicians who can do both well, treating the mind and the body with fidelity to the science and modern best practices. Getting people back in their body and trusting it again is transformative and leads to lasting change and new protective neural pathways. Basically, we're using the body to show the brain that the world is safe again. I hope you feel empowered to hold the body and mind with equal regard as you navigate your healing journey.